Okay, we're going to try this one more time. I didn't realize that I got this camcorder not too long ago and have not really tried much with it. And so what happened was the batteries were dead in the wireless microphones. And I know the one that you wear, I changed the battery, but I didn't know that the one that's on the camcorder needed a battery as well. So that one was probably dead too. So I did this really good video, and like what has happened before, I got partway through and all of a sudden you can see me talking, but I'm not really talking. And I realize now I was talking, but you couldn't hear me. And now I remember on the little screen there's a little gauge on there that moves as you're talking, and that means that the microphone is working. So we'll try this again. Yesterday I went to see my therapist, and now we're just gonna not even get technical because I'm nervous about how this is gonna pan out. Went yesterday to see my psychiatrist, and there was a mix-up where I thought my appointment was at 1:30 because the nurse wasn't going to be there. So I showed up at 1:30 and they said your appointment was at 1 o'clock. And I said, no, you called and changed it to 1:30. No, it was just a clusterfuck. But I had my appointment with my therapist at 2 o'clock. So I was at least able, it wasn't a wasted trip. I was still able to see him. Yay. And now my blanket's fucked up and it's going to irritate me if I don't fix it. So anyway, I'll just skip over how I manipulate him. No, it's my opinion that I'm smarter than he is, and he would never... Oh, that's better. Because he's educated, he thinks he's smarter than me, but it's called education of life that can make you smarter. So we talked a little bit about borderline personality disorder, and I said, yeah, I went with David a couple weeks ago to his therapy appointment and diagnosed him with borderline personality disorder. I was, I believe, at the Mayo Clinic website, or maybe, I don't know how I found it, but it was all the symptoms and all the signs and things like that. Because our last psychiatrist, I believe, slapped rage on him and left it at that because she was leaving the practice. So I believe she just wanted to label him by his behavior and decided that would be good enough. So I forgot my hair is sticking up all over because my last video was just 7 minutes shy of 30 minutes because this only records for 30 minutes. So anyway, I believe she just wanted to give him some kind of diagnosis. And now, looking at things, doing these videos and looking at how he behaves, he has so many symptoms, signs, whatever. I think they call them symptoms. And so I just screenshotted that and went to see his therapist with him. And today was his last time with her because she's leaving. But they have a different one lined up for him. So that's good. So they talked about it, and the therapist actually believes I'm right. So she put that in the notes for the next therapist, his new one. So now at least we have some answers to why he does the things he does. Because to me, rage is just exploding and being an asshole all the time. No, not really. But, just having this uncontrollable, anger all the time. And that's probably what it is. I've never really looked it up. But that's beside the point. I saw more than just irritation and anger and, things like that. So I brought it up to her. And today she must have maybe did some research on his history, because they've been seeing each other for quite some time. So she's really gotten to know him well. And so they talked about that, and she believes that I'm right. And when he told me that today, after he saw her, I was like, I wasn't happy that I was right. I was happy that I'm helping him. Because I just didn't think what was said before was correct. There was more to it. So I saw my psychiatrist today, and they got wind that I was very unhappy, that I felt like she wasn't helping me, because seeing her, trying to adjust my meds and seeing her every 3 months isn't helping me. I'm just doing the same thing that I always have been. So she found that out, and she said, okay, fine, every 3 months isn't often enough. I'm going to see you every 2 weeks. Oh, fuck. Pandora's box. So, okay, fine. She really wants to get me off Xanax. Bad. She wants to get me off the benzos. Bad. I told her I didn't think the diazepam was doing anything. I said, unless it's that subtle. So then she wants me to knock my milligrams of my Xanax down from 2. I'm taking 2 a day, and she wants me to take 1.5 a day. She's like, we talked about no, you were not clear about what you wanted me to do. So I didn't say that. I get along with her pretty good. I give her a lot of shit. And she's one who doesn't seem to get that very often. So I make her laugh. And that's my job in life, is to make people laugh. And she takes it pretty well. In the beginning, we didn't get along very well. I hated her because I didn't know that the appointments are 15 minutes long. And I don't think the first one was. But the first words, or the first questions, the first words out of her mouth was, so how'd your 8-year-old son die? Well, hi, Debbie, nice to meet you. And where's the introduction? Not, so how'd your son die? That was like, fuck her. That's just not a way, and then I found out later that the appointments are just really short. And they're telemed, where, you're on the screen. And, you do that this way, or you do it that way. And so now, we get along better. It's still 15 minutes, and yeah, I guess it's good enough. It's apparently the way they do it here is like your therapist takes all the notes and passes them on to her, and then she reads them, and then when she sees you, she knows all that, what's been going on. So it really isn't that bad, because there's times where it's like, do I really gotta fucking be here? I don't want to be there at all, as a matter of fact. But I see my therapist every 2 weeks, which I think is excessive. But then again, by the time 2 weeks comes around, I have plenty to talk about. And I just sit there like I am now and just, yak. If he has any questions, he asks. but it's hard for him to get a word in edgewise because I don't want to listen to his dumbass. But he's like, just hang on, let me ask you this. And I'm like, fine, what? And I just get frustrated because I don't want to listen to him. He's just a boy. I know I chose to have a male. I didn't have to. And I had the opportunity to switch. And I didn't. I like him when he's sitting there in the corner shutting the fuck up. No. I have mixed feelings. Sometimes he's good. Sometimes he just irritates me. And most of the time he just irritates me. Because he thinks he knows it all. He has a whiteboard. He gets out a dry erase board. He likes to get out and write, like when I'm not agreeing with him or I'm like not understanding what he's asking me because it's like stupid. But he's trying to help me. Yeah, he's trying to help me with my borderline, but I've been this way so long, and I realize that you kind of just get used to it. And do I want help? In a week, I'll be 53, and I'm kind of used to me this way. I'm kind of used to being this way. And I forgot I have cookies downstairs. I don't know what the hell. It's 9 o'clock already. Jeez. I don't know where the day went. But, yeah, I was happy. Not happy like that, but happy to help David. So he can kind of get control of the situation, of his moods and his situation that he's in. I knew it wasn't rage. I knew there was more to it. I just had to observe, look at my notes, pay attention to what I read. And that's just it. I can help other people, but when it comes to me, either I can't help myself or I don't want help. Because when you get to this age, by now you are who you are, and why, you've made it this far. And David's talking about suicide and all that. And it's like, when? He never talked to me about that. So I feel kind of bad. But anyway, yeah, it was pretty warm here today. It was 24 Fahrenheit. Doesn't sound warm, except the last couple of days it's been -13 Fahrenheit, -4, -6. It's been cold. So I got this camcorder. First I think I got a different camera and I sold it. And I got this camcorder, but I've always been into photography, and you wouldn't know it because my pictures are crappy half the time, but I enjoy it. It's a good hobby to have. So then I got this camcorder, and it's a Canon, so it's going to be good. And yeah, the last video that I did without any volume, without any audio, which again, I'm like, shit. So, now this one should have video. I mean, it has video. I can see that. But I got this camcorder, and this is the first time that I'm actually doing a video on it. And so far, it looks like you can look at the little screen and see if things are working the way they should be. And it looks like they are. And my last video was really good, and that happens every time I make a halfway decent video. So I went outside today and Took some pictures of the dogs and the trees, and because there's a little bit of snow, and just took some pictures and got out for, I don't know, probably 15 minutes was long enough for me, and came in, and then I used editing tools I can edit pictures as in make them lighter, darker, add words and things like that. I just can't edit videos. I don't know how. I think this one I'm gonna have to edit because it's hard to find. There's no remote, so it's hard to find the off button to stop the video. Some of them have remote controls, and I'm looking for one like that. So then, anyway, I was looking for, this is a Canon, and Nikon those two are neck and neck, as in the best. So I went, back on Marketplace, Facebook Marketplace, and I found myself a Canon camera similar to the one I used to have. And I picked that up. We went far for that, over 2 hours. But the batteries, the guy must have used it more than he admitted, or I don't know, but the batteries are kind of crappy. They don't last very long. So I have to go to Amazon and pick up some batteries. After my fun time with Amazon, I did get my refund. If anybody watching this watches my videos and knows about my lovely struggle with Amazon, I made a return, and they had a big fit about giving me my money back. And yeah, I ended up, you just go Jeff at Amazon.com, and that's Jeff Bezos, who happens to own Amazon. So then I sent them all the evidence I had that I did send it back. And it took a couple of days and a couple questions, and I had all the evidence. It wasn't $6 or $7. It was over $85. So all of a sudden I woke up one morning and I looked at my phone and I saw my email, and sure as shit, I got my money back, and I deserved it. I had proof. So right now I'm a little scared to order from Amazon, but I'm gonna go for it, and we'll see what happens. Don't play games with this dog. God, I sound like I live in the South. So anyway, yeah, I would appreciate some comments. Let me know what you like, what you don't like, if you're having any struggles. I do go live usually pretty late at night, because then I'm more calmed down, I have more thoughts together. I do help one person who we don't make a date, but when I'm ready to go live, I let him know, because he lives in a family that he lives where in his life he can't talk to anybody about his issues. So he said I'm the only one he can talk to, and I appreciate that, because I do work really hard making these videos and doing research and finding shit out that people don't want to admit. I don't want to admit it, but yeah, I do. I work really hard. I don't edit because I want you to know me. I want to be real. I want to be a human being who has feelings, who has issues. I don't want to be a robot. Well, unless it has x-ray vision. I'm just kidding. But anyway, I think I'm going to leave it at that. If you wouldn't mind liking, subscribing, all that fun stuff that makes the algorithm, which I can't say algorithm, I can't say that word, but that makes YouTube happy. And I've been looking at my screen instead of the camera the whole time, so whatever. This is my first time using my camcorder, and there's a fuzz flying around. First time using my camcorder, so I really hope that it turns out, because it'll be the second one, and the first one was a flop. So we'll try again, and I'm not one to quit. I am not a quitter. So I hope you have a fantastic night or day, depending upon what time you watch this. And I hope that you are happy and keep smiling, chin up. Take care.